Hey, you're listening to Ultra Life Today. Adam Payne is on the end. I'm here, Josh Bellew. We've got Dr. Bryan Frank giving us some crazy and fascinating information
sandwiched between us here
about biomagnetic pair therapy and acupuncture, and we're going to circle the wagons back around because we started out with an interesting topic about the International Society for Medical Laser Applications and how Adam and Dr. Bryan Frank connected, and I think I'll let you take it from there, Doc.
Yeah. So
this this conference that you went to, this was after we had developed UltraCur.
Right.
And so
Soon after.
And you had actually done some research with it.
Right.
And we had done some research. We had measured it in mice. We did a mirroring model of bioavailability, and we had some data. And you got very excited about this and asked if you could present this in Germany. And I'm like, sure, go ahead. Go.
There's only
I had
gonna
no
be,
idea what you were going to do
There's
with
only
it.
going to be 40 nations present and around 200 doctors. So, but no big deal.
That's true. Yeah, that's right.
But I didn't know this, Josh. I had no idea.
I know.
So why at a laser meeting was I interested in
And curcumin, yeah. What does curcumin have to do with lasers?
So we've talked in previous segment about how we can use lasers for physical medicine applications, musculoskeletal things. We've talked about how we can use lasers as needles of light rather than acupuncture needles when we do acupuncture. But another fascinating aspect of lasers is we have the technology now, we do it in my clinic, where we can do intravenous or transvenous laser light therapy. And the reason we do that is because all of the
Hold on. So
Yeah, wait a minute. You can't
intravenous laser
you can't
light
breeze
therapy.
over that.
Yeah.
So what you're injecting laser light into the veins?
Well, Dr. Weber, who developed my equipment and who sponsors the international conferences on these laser medicine conferences, he developed a sterile single-use device that would carry. We would simply start a regular IV,
Okay.
tape that in the arm, and then this little device he developed was fiber optic.
Oh, so it's like a little fiber optic, what do you call it? Filament.
Yeah.
That goes into
Exactly.
the IV tube.
So, sterile, single use, we would start the IV and then we would slip that filament into the catheter, and then we would connect that to the laser light.
Oh, wow. So it truly is
literally
intravenous laser light. Wow.
Why do we do that? Well, because if you're suffering from Lyme disease, for instance, or if you're suffering from a common cold or COVID or whatever it is, laser light therapy does tremendous things in your bloodstream for the immune system. It kills cancer cells, it kills viruses, it kills bacteria, things like that. And so subsequently, he came back and developed a mouthpiece that you put the laser cables into, and then we slip a clean, a plastic bag, single use, obviously, and then the patient puts it under the tongue because those vessels under
sublingual.
the tongue, sublingual. Those vessels are very, very close to the surface, and so now we can transfer the light into those vessels without even having to do a stick.
Interesting.
So we knew even early on, it was known that there are a number of photomodulators, a number of things that enhance the benefits of
So
laser light.
that begs the question:
Yeah.
why would somebody want to put laser light into their bloodstream?
Well, if you had Lyme disease.
Oh, Lyme disease.
if you
Yeah,
had
we
a
talked
flu-
about
if
that,
you had
right.
a cold, if you had a flu.
So what?
I'm looking for the curcumin.
Yeah. So why does
connection and
curcumin?
lasers.
So actually, I know the answer to this one,
Yeah.
and
It's a setup.
so curcumin has a unique characteristic of absorbing light at very specific wavelengths.
Right.
I think it's 464 and 620. I could be wrong. Regardless, there are, and it absorbs that energy very specifically, and so I think it was it. That's the reason, right?
Yeah, because it enhances the benefits of the laser light therapy.
Yes.
So
So where the curcumin attaches to, would actually enhance the energetic absorption of those points or those cells.
Yeah, yeah. And so you would have a better effect against viruses, against bacteria, against parasites, against cancer cells, things like that. So that's what I presented that first year, and then subsequently 3 years in a row.
So what I learned actually after a while, after you did this, was that Dr. Weber's group had been doing intravenous curcumin therapy for cancer patients. And they'd figured out a way to do that, which is just absolutely astonishing to me. And they were taking and then they were providing the laser light therapy after the fact as a way to modulate inflammation and different cancer therapeutics, right? And so I think they got really excited by the potential of having an oral therapy that would do the same benefit as intravenous curcumin.
Right. And of course, what really excited them was the ultra-high bioavailability of UltraCur.
That's right, yeah.
Yeah, so presented that, and Dr. Weber himself was very, very keen, and I put him in touch with you, and he's been a very, very strong ultra doc.
Well, you know what I think really clinched it, though, and I heard the story that Dr. Parita, Joseph Parita, was in the audience at the time, and we're gonna get him as a guest here. He said he'd come on.
Fun.
Yeah, that'd be great.
He's one of the leading stem cell guys in the country. He had. He was in the audience when you made your presentation.
Correct.
And unbeknownst to you, he had horrible knee pain going on that prolotherapy and stem cell therapy hadn't worked on. And so do you recall giving him a sample of curcumin at the conference?
I think I probably did. There was him and another American physician that was there, and the two of them became very, very keen on UltraCur very quickly.
Yeah, I think Joe told me, Dr. Parita told me, saying, look, Adam, you don't need to convince me anything about your product. And I'm like, why, Doc? He said, I had terrible knee pain. And Dr. Frank gave me a sample of it, and it worked within 30 minutes. You don't have to convince me of anything. I know your product works. And he talks just like that.
That's great.
That's right.
How fun is that?
There's nothing like personal experience to kind of change your opinion of something.
Yeah.
Hey, let me interrupt real quickly because we've got listeners that are probably just waiting with bated breath to hear how they can get a hold of Dr. Bryan Frank. So you can reach out to Dr. Bryan Frank at this area code 405, and the number to call is 763-7603. That's 405-763-7603. And then also on the web, you can reach him at regenesishealth.com, and that's re-genesishealth.com. Gosh, people are going to be burning up your phone. So this has been fascinating.
Yeah.
So it was after that conference, Doc, that the Webers actually reached out to us, and they started ordering our professional-grade curcumin from us. And Dr. Parita also called us up and started ordering curcumin for his stem cell patients.
Yep.
And then we got really close, and we were. It was at that time that was actually before Ultra Botanica was born. So this was early 2014.
Exactly. Yeah.
As 2014 turned into 2015, in mid 2015, God had a plan, had different plans for me and for the technology. We decided to form Ultra Botanica as its own company, focused on the curcumin, and it was at that time that we invited you to be our chief medical officer. So I think you've been our chief medical officer since the beginning.
Early on.
Early on. And a board
since
member.
the genesis
Of the
our
regenesis
company. There we go.
of our curcumin technology. How do you use curcumin in your practice? Are you doing laser light therapy now, or do you, or do you? I know you do a lot of magnetic therapy, but I'd love for our listeners to know how you integrate curcumin into your practice. Do you? I know this is a stupid trick question because I know he buys product from us. He's buying. Dr. Frank's been buying product from us almost every month for a long time. So I'm not going to ask the question of if you use it in your practice, but how are you using UltraCur in your practice today?
So we use UltraCur for people that have just the common aches and pains of life. And so that's a common use for it. But beyond that, we also use it, especially in the pro encapsulation. We use that for a variety of inflammatory, autoimmune, or cancer-related conditions that they have. And we also, in my own, one of my family members that had very, very serious Alzheimer's, we found that she was fairly in stage when we put her on the UltraCur, but what
Wow.
it did do, so her memory wasn't so much better, but her agitation and her anxiety and stuff dramatically improved, and so
That's a blessing.
Yeah.
Wow.
So and I think
I don't know
really,
if I recall that story, but
Yeah.
so you were using it to treat your relative for that had pretty end stage Alzheimer's.
Yeah, and I suspect that in patients, if you are just in the early stages of that dementia, that I think that the anti-inflammatory aspect of the curcumin and UltraCur would be likely beneficial. I've got a patient recently that is in that situation. So,
Oh, interesting.
yeah, so we're putting her on the Pro capsule twice a day, and in a month we'll follow up and see. So hopefully, because it's early, she may even sort
Derive
of
more
wake
benefit.
up.
Yeah.
That's really cool.
Let's see. We also, I have had a number of diabetic patients because in functional medicine we look at diabetes. It's not just elevated blood sugar, right?
Right.
In functional medicine, we understand that you have oxidative stress leads to inflammation, leads to autoimmune conditions. And so really diabetes, blood pressure problems, things like that, in functional medicine, we would look at them as autoimmune, and with inflammation as a major
Oh,
component.
that makes sense.
And so I've had a number of patients that have significantly improved their laboratory values with their diabetes on the UltraCur. And so that's been important.
Yeah. So hold on. It's mid-recording haze here going on in my brain. I need some more UltraCur. So you're seeing benefits with blood sugar levels in patients?
Right.
Oh, that's fascinating.
Yeah.
And in fact, we do know that curcumin attaches to the AMPK system for glucose metabolism, which is similar to what metformin does. But let's take a quick break, and we'll be right back after the break and continue our discussion. This is Ultra Life Today. Our mission is to take nature's most beloved botanicals and enhance them with our liquid protein scaffold technology. This helps it reach your cells faster and better. With exponentially enhanced bioavailability, you'll feel better every day. Ultra Botanica, the feel-good curcumin.
All right, we're back. Ultra Life Today. We're sitting here talking to Dr. Bryan Frank. Adam Payne's on the end, CEO of Ultra Botanica. I'm Josh Bellew, and I want to let listeners know, because I know you're in your cars and doing things, and it's busy for you. So here's how you can reach Dr. Bryan Frank, because the thing that hits me about listening to someone like Dr. Frank, even though this man can write a prescription, this man has got so many initials next to his name, you haven't heard him talk about a prescription on this show yet, because he's always seeking to find the answer for what is causing your health challenge, and then being able to address it in a holistic manner that's just fascinating to me, fascinating to Adam. So you can reach out and touch base with Dr. Bryan Frank of Regenesis Health at 405-763-7603. That's 405-763-7603. And online, you can reach out to regenesishealth.com. You'll type in re-genesishealth.com. Gosh, this has been fun. Let's keep going.
So where have we been? We've been talking about diabetes and Alzheimer's and how you can use it for curcumin, and and you use it for the aches and pains. So a lot of our listeners, Doc, don't know that we have a clinical version of UltraCur, and we have an original version of UltraCur. We also have advanced and defense and broccoli and
And on, and
on and
on.
on. But the clinical version, UltraCur Pro, is only sold through doctors' offices and compounding pharmacies. It's 4 times more concentrated than our original curcumin. And the reason why it's only through prescription or through a doctor's recommendation is because it can and does interact with the thrombin system in the body. Have you ever seen issues with people with that, with bleeding?
The only issue I've seen with that is in my twin brother,
Your twin brother.
who for a time was on blood thinners, Eliquis for AFib,
Yep.
and he was also on UltraCur, and so he would bruise very easily.
Oh, on the combination.
But I mean, you're talking about the combination of UltraCur and Eliquis, which is
They're both actually FXA node inhibitors, right?
Yeah. So all he did is we had him cut back on his dosing of UltraCur for a while, and then fortunately he had his ablation therapy and got rid of the AFib, and so he was able to get off of Eliquis, and so that's not a problem anymore.
That's good. Yeah. So that we're very careful for people's health. We don't want people to get into any kind of risk situation, and the only people we really feel comfortable in managing that risk are health professionals like Dr. Frank. And the Pro has its place, doesn't it? As well as the original formula.
Oh yeah, and so very often if it's people with common aches and pains, that they'll get on, like Dr. Parita did, the feel good.
The original, yeah.
The
Original, and you take 1 or 2 capsules, maybe twice a day. That really is tremendously beneficial for so many people. But
Including myself. I take the original, like 2 to 3 capsules once or twice a day.
and so if a patient has a condition, whether it's pain related, inflammatory, or especially for, in my practice, autoimmune, cancer, things like that, then, or if they simply need more than a couple of the original formula twice a day, then it becomes really
It makes more sense.
It makes more sense to take the Pro, say 1 capsule usually just twice a day.
In fact, it is kind of a savings.
It is.
Because it's 4 times more curcumin, but it's only about twice the price of the original.
Yeah, not even twice. So
Yeah,
so it does become more economical for them.
Yeah, absolutely. So it's like 4 to 1 savings. But you got to go see a doctor or a compounding pharmacist to get it done. We've had a lot of fun in developing these different formulas over the years. I think you helped us develop our UltraCur Advanced formula that we came out with, which was frankincense, devil's claw, and curcumin. You've helped us. You worked on our Boost product, and you've worked on a couple of other of our private label products that we've come in.
Right.
You've consulted with us quite a number of times in different formulations over the years. So, Doc, what's your favorite part about practicing medicine? I mean, come on, getting down to the Bryan Frank that I have. What makes your boat?
Well, you know what frustrates me in contemporary American medicine is that it is so focused on symptoms and so focused on medicating those symptoms.
Right.
Symptom, drug, treat symptoms. Symptom, drug, treat symptoms.
So a Band-Aid over the skin, basically.
And thankfully, over my
Or inside the skin, right?
Yeah, there you go.
over 40 years of my private practice career as an anesthesiologist, a pain specialist, and acupuncturist, and all these things that we've been talking about. I'm really trying to seek, okay, what's the underlying cause of the problem, and can we address that?
So I know, a lot of people don't know this, but you're actually a minister.
Yep, I'm a pastor.
You're a pastor, and you've been filled with the gifts of the Holy Spirit, and you not only practice medicine, but you are a man of prayer and power. Because I've seen the power. I was actually I went to a seminar that you did at Victory Church on the gifts of the Holy Spirit, and we actually in kind of the practicum of that one of those sessions, there was a guy there that was pretty sick.
Yeah, he really was.
I don't remember what it was, but it was like a life, or not a life or death, but pretty significant life issue. And I don't remember what it was. But we said, okay, we're God tells us this is how we're supposed to do this in terms of laying on
Let's
of
do a
hands.
clinical research study right here in church, right?
Yeah, so this gentleman had years of significant debilitating pain.
Oh my gosh.
He was opioid dependent, and so we just laid hands on him and prayed and commanded that he receive his healing. And just, if you'll remember, he dropped. He was standing as I was laying my hands on him, and then he dropped to his knees and put his head and his arms on the table in front of him and just began weeping. And it had to be a God thing, because he was going to go to another class that night, and they actually did not have a session that first week.
Oh,
And
so he's like, I better go to this other one.
Well, no. So he texted his wife, who was in my session,
Oh, wow.
and he said, our session doesn't start till next week. I'm going to go home. And she said, well, I'm here at this one, and his
Oh,
best
even
friend
better.
was there at this one, and said, why don't you come see if this guy has anything to say?
Okay.
Yay.
So at the end, then they a couple of the women came up and said, hey, would you pray for our friend? So we did, and he's dropped to his knees. He's sobbing, and I said, tell me. Well, he looked up and he said, you just cannot imagine how horrible the pain has been. And all I could think to say was, well, and how is it now? And the sobbing stopped, and he just had this cathartic, victory
Wow.
look on his face, and he said, oh, it feels so good.
Oh my gosh.
Wow.
And he went
Pain
home-
exiting the body.
Yeah,
How nice is that?
And he stood up straight, and he said, had no pain. He says, I haven't experienced this in years. And he went home that night and flushed all
All of his medication up.
opioid medications.
Wow.
Which we do
That's
not
great.
recommend, by the way, unless you have had an act of God take place in your life. Just saying.
Thank you, Josh.
He went to work the next day and had a couple of other buddies at his workplace that were on opioids for pain problems, and he told them what had happened and that he'd flushed it, and they sort of said, "Oh,
Well, you could have given it to me.
Well, gee,
Sorry.
that wasn't the
That's
answer
not the right
I was
response.
hoping for.
It'd be like, it should have been like, where's this guy? I want him to pray for me,
Yeah,
right?
yeah.
Yeah.
So anyway, so you asked, what really lights my fire in medicine is trying to address, to ascertain and address the source of the problem rather than just treating the symptoms. And yes, I do use some pharmaceuticals, but a fraction of what most doctors do.
Right.
I like all the ultra products. I like a lot of other botanicals. About 2/3 of my practice is in the functional medicine realm. About 1/3. So that's bioidentical natural hormones, adrenal, thyroid, diabetes support, stuff like that. And then about 2/3 is one of these modalities or another for a natural integrative pain management. And really, we've talked about laser, we've talked about microcurrent and pulse wave and magnets
There's
and all
also
that.
prolotherapy. We haven't even
Yeah, I was
talked
going to
about.
say, we've got 3
Stem
minutes
cell.
left,
Yeah.
but we really ought to talk about prolotherapy
Yeah, that's-
really quick.
but, you know,
'Cause
but
this is
that's
kind of my
actually-
finest thing
But
you do.
here's what I've noticed about you over the years, Doc. I think God has led you into so many different modalities of the human body, and He's let you, and He has He's gone by your side, Doc, and taken you by the hand and said, "Look how marvelous I've made the human body. Look at these, look at these amazing things with magnetic currents. Look at these amazing things with acupuncture meridians that, has been traditional medicine in China, but let's look at it in terms of a functional approach. Let's look at all these herbal ingredients that can have a profound impact on the human body. Let's look at and then, by the way, I'm the God who heals by just the word of my command, and the power of the resurrection of the Christ is transformative in and of itself. The greatest Band-Aid.
Yeah, absolutely.
Absolutely.
Okay,
But-
before we hear about prolotherapy, I want to mention one more time how you can get a hold of Dr. Bryan Frank. Hey, he may pray for you.
He should.
Anyway, area code 405-763-7603, Dr. Bryan Frank, 405-763-7603, and then at regenesishealth.com, and that's re-genesishealth.com. Okay.
So what is prolotherapy?
Yeah,
Prolotherapy is the original stem cell therapy. at a tiny fraction of the cost of the newer
that's nice to
modalities
know.
of stem cell therapy. And it's been around for about 90 years, was developed in America. And so when a doctor tells you you're bone on bone in your knee, there's nothing we can do but operate.
They're lying.
Well,
They don't know.
They're ignorant, right?
They
just
don't know. And
Right.
so 80-90% of the time, we're able to regenerate that, and they never need surgery.
So I mean that's pretty incredible.
Hold the phone.
So
What happened just then?
yeah.
Yeah.
So you can regenerate bone on bone.
Sure. Yeah, and I've got X-rays from my patients to show that.
And so what is
but
what
it
is
might-
Prolo? What does that
Yeah.
stand for?
So Prolo stands for proliferative therapy.
Okay.
And what the solutions we use, we're not injecting stem cells, we're injecting a solution that stimulates the proliferation or the flooding in of a patient's own stem cells and growth factors.
You mean our bodies
So-
are actually supposed to heal
so,
themselves given the right
So,
conditions?
so folks, this is actually the positive side of inflammation, right?
Yes,
Because you're actually
There you go.
instigating a very specific inflammatory response where you don't want to give. You tell them what? Don't take ibuprofen, right?
correct, yeah.
Right. Let the joint hurt because this is positive inflammation.
The stem cells are actually, those are the very immature inflammatory cells.
Right.
So those will, if given the chance, they will, say for a worn out knee, they will literally regenerate new healthy cartilage.
So here's what we learned in what I've learned in my years of not practicing medicine, but practicing development of medicines and herbal stuff, is that the body will not start healing until it's stopped the attack mode
Right.
of inflammation. That what in scientific terms called the T helper cell 1 response, Th1 response. I can speak, folks, is the attack mode, and the T helper cell 2 response is the rebuild cycle, where the body's actually, the engineers are in town rebuilding the tissues. So how do you get the body to initiate that Th2 response so quickly?
Well, when we do prolotherapy, again, it's the solution that we're putting into the joint. Now, that can be inside the joint, intra-articular in the knee, and that would regenerate healthy cartilage. It can be around what we call peri-articular, around the joint, and that could be literally any of the joints in the spine.
Like you're talking about ligaments, connective
ligaments
tissue.
and tendons that surround
So
the joints.
you're seeing connective tissue actually regenerate.
Oh, absolutely, yeah. And so,
And you're injecting this, right?
yeah,
Just
it
so
may
people
be,
understand just
you
how
know,
you administer
I
this.
have a
Yeah.
stupid. I have a question. Can you? Would this be like? Could you do like a facelift with this? Inject it into my aging face and
well, there's other ways to do that.
okay.
There's other ways
But
to do
seriously,
that. But for musculoskeletal medicine, you know, you can do classic prolotherapy, which is the original stem cell. You can do platelet-rich plasma, which is what I consider kind of the second generation.
okay.
And then you have the more contemporary versions lately where they use.
So the platelets actually are kind of the late stage. Okay, we're about to start the healing process.
Yeah, they're going to signal the healing and repair.
Oh, that's so cool.
Yeah.
That is so cool.
So it may be anywhere, upper or lower back pain. It may be your hips. It may be your ankles. It may be your tennis elbow. It may be your rotator cuff.
So I heard Dr. Parit actually uses curcumin in conjunction with prolotherapy and stem cell therapy because he believes that it helps engender the shift to the regenerating response. Are you
Yeah.
doing that too, or are you kind of holding off?
Yeah, we're doing that some, and you know that's actually curcumin is different from say Advil, Aleve, ibuprofen.
Yeah, very
because those do diminish the healing response.
Oh, interesting.
And recently, actually, when we were on Saturday morning with Kyle, we talked about that. But the same people that put this article forth said that they did not feel like curcumin and boswellia had those same effects.
They don't.
Yeah.
In fact, they actually engender a healing response.
Exactly. So
It's-
yeah. So
Where can people go to connect with Dr. Frank?
Yeah, before we wind down this segment of Ultra Life today with Dr. Bryan Frank and Adam Payne, you can reach out to Dr. Bryan Frank at area code 405-763-7603, 405-763-7603, and online at regenesishealth.com. That's re-genesishealth.com. And this has been so unbelievably
Oh,
fascinating.
we have to do this again.
Yeah, this is,
definitely-
we could do
will you
this
come
for
back?
a long time.
sure. Yeah.
Yeah, this is who we are. I'm Adam Payne. Bryan Frank next to me again. Josh Bellew in the studios. We are Ultralife Today. Thanks for joining us, folks. Please stay tuned for us being live in the studio, taking your calls, answering your questions. Ultralife Today.